All right, this is chapter 16. It's going to cover caring for common medical emergencies. The objectives for this chapter: define the following terms: altered mental status, behavioral emergency, convulsions, diabetes, epilepsy, febrile, generalized seizure, hemodialysis, hyperglycemia, hypoglycemia, overdose, partial seizure, postictal, sepsis, stroke, also known as a brain attack. Objective number 2, explain the common causes of altered mental status. Number 3, describe the signs and symptoms of a patient with an altered mental status. Number 4, explain the appropriate assessment and care for a patient with an altered mental status. Number 5, describe the signs and symptoms of a patient experiencing a generalized seizure. Number 6, explain the appropriate assessment and care for a patient experiencing a generalized seizure. Number 7, describe the signs and symptoms of a patient experiencing a stroke, also known as a brain attack. Explain the appropriate assessment and care for a patient experiencing a stroke or brain attack. Describe the signs and symptoms of a patient experiencing a diabetic emergency. Differentiate between the signs and symptoms of hyperglycemia and hypoglycemia. Explain the appropriate assessment and care for a patient experiencing a diabetic emergency. Describe the signs and symptoms of a patient experiencing an overdose or a poisoning. Describe the signs and symptoms of a patient experiencing carbon monoxide poisoning. Explain the appropriate assessment and care of a patient experiencing overdose or poisoning. State when it's most appropriate to contact the Poison Control Center. Describe the signs and symptoms of a patient experiencing an emergency related to renal failure. Explain the special considerations when caring for a hemodialysis patient. Describe the signs and symptoms of patients experiencing generalized infection or sepsis. Explain the appropriate assessment and care for a patient experiencing a generalized infection. Describe the signs and symptoms of an allergic reaction. Explain the appropriate assessment and care for a patient experiencing a severe allergic reaction. Describe the signs and symptoms of a patient experiencing a suspected behavioral emergency. Explain the appropriate assessment and care for a patient experiencing suspected behavioral emergency. Demonstrate the ability to appropriately assess and care for a patient experiencing an altered mental status. Value the significance of an altered mental status as a sign of an unstable patient. Alright, medical emergencies. These could be caused by infections, poisons, or failure of one or more of the body's systems. Signs and symptoms of general medical emergencies include altered mental status, abnormal pulse rate and rhythm, abnormal breathing rate and character, abnormal skin signs, abnormal pupil size or response, unusual breath odors, tenderness or rigidity in the abdomen, abnormal muscle activity, spasms or paralysis, bleeding or discharges from the body, pain, shortness of breath, fever or chills, upset stomach and or vomiting, dizziness or feeling faint, chest or abdominal pain, unusual bowel or bladder activity, thirst, hunger, or odd taste in the mouth. When you're assessing these individuals, make sure you take appropriate BSI precautions, complete a scene size up, perform a primary assessment, perform a secondary assessment, complete any additional reassessments that are required, comfort and reassure the patient while awaiting additional resources. Alright, think about it. You respond to a single motor vehicle collision with a minor mechanism of injury. Your patient is unresponsive. What conditions could have preceded the collision? So you got to think about it. If there's a motor vehicle accident and it doesn't look very bad, or it doesn't look bad enough to have caused this individual to be unresponsive, you got to think about some medical things. This individual could have had a heart attack and gone into cardiac arrest prior to wrecking their vehicle. They could have had a stroke. They could have had any number of medical conditions that caused them to go unconscious. So you've always got to look at the possible medical causes, especially if your mechanism of injury does not show any reason why the patient should be unconscious or have an altered mental status. All right, how might the EMR proceed with assessment and treatment in this case? So you always have to look at both sides of the coin. Okay, so mechanism of injury that does not look terribly bad could possibly still have caused this individual to be unconscious. So you want to take the same precautions that you would with a more significant mechanism of injury. However, you need to be on high suspicion for medical causes. So take spinal precautions, keep the patient secure. However, you need to be looking for possible medical causes as well. All right, evaluating the mental status. So for a normal mental status, they're completely aware of their surroundings and they know exactly what's going on. This individual is alert to person, as in they know who they are. They're they're aware of the place they're in. They know where they're at. They're aware of the time. They know what day it is. They know exactly what the exact time and date is. And they're aware of the events that are currently going on with them and as well as in the general world. Decreased patient with an altered mental status is going to have decreased alertness and responsiveness to the surroundings. They may be confused and they may also be slow to respond. This can go much further than that, but that's a individual that's just a little bit altered. All right, this is a patient with an altered mental status. They're often confused and not really aware of what's going on. Glasgow Coma Scale, or GCS. This is a standardized tool to describe the level of responsiveness. It's used by EMTs and paramedics. It's useful for trauma and medical patients. All right, when you're scoring someone's GCS, you're going to have the highest score possible as a 15. The lowest score possible is a 3. So even a dead person that is real dead is going to have a score of 3. You get a maximum of 4 points for eye opening. You get a maximum of 5 points for the verbal response. And you get a maximum of 6 points for the motor response. We're going to go over the parameters for these points in the next slide. All right, so this is a image of the GCS score scale. So let's start with eye opening. If you spontaneously open your eyes, you're going to get a 4 for that one. If I have to talk to you, say your name, make some noise, you're going to get a 3. If I have to inflict pain on you for you to open your eyes, you're going to get a score of a 2. If you don't open your eyes, even for a painful response, you're going to get a 1. All right, so verbal response. If you're oriented and you're able to talk back and forth with me, you're going to get a 5. If you're disoriented and confused, but you're still able to talk back and forth with me, you're going to get a 4. If you use inappropriate words when I ask you questions and you're not able to answer me appropriately, you're going to get a 3. If you just make incomprehensible sounds and you're not able to communicate with me, you're going to get a 2. If you do not respond to me at all, you're going to get a 1. All right, so for motor response, if I tell you to do something and you do it, it means you're obeying verbal commands. You're going to get a 6. If I inflict pain on your body and you reach to the source of the pain and try to remove it from your body, you're going to get a 5. That means you're able to localize pain. If you withdraw from the pain, which means I inflict painful stimulation to your body and you try to pull away, you're going to get a 4. If you have abnormal flexion in response to pain, which is going to be decorticate rigidity, um, you're going to get a 3. If you have extension in response to pain, which is decertabit rigidity, you're going to get a 2. If you have no response, you're going to get a 1. All right, let's step back to decorticate rigidity. So this is going to be flexion towards the spinal cord. It's a good way to think about it. Just look at the corticate cord, the other one is mostly extension. It's going to be away from the cord. All right, some common causes of altered mental status is going to be trauma to the head, seizures, stroke or brain attacks, diabetic emergencies, poisonings or overdoses, hypoxia, shock, infection, trauma, psychiatric condition, and liver failure. All right, so what do you think the most immediately life-threatening causes are? Head injury ranks up there high, shock, infection, strokes. They're all very severe. All right, this is just a chart with some common causes of an altered mental status. Start with the top at the 1 o'clock position. Heart rhythm disturbances and heart attacks. They can cause this because of a decrease of blood pressure. Dementia. This is something that's chronic. Infection. This can also cause shock and confusion. Medication related. Depending on the type of medication, it can cause changes in mental status. Decreased blood volume. Obviously, that's going to cause a decrease in blood pressure and perfusion to the brain, which can in turn cause the altered mental status. Respiratory disorders and hypoxia. Again, this relates to lack of oxygenation. Hypothermia or hyperthermia. Hypothermia is going to be related to cold. Hyperthermia is related to hot. This can just affect the brain and cause somebody to be less aware and their mental status to decrease. Decreased blood sugar levels. This is going to be something that we're dealing with in diabetic patients. Contrary to popular belief, if you're a healthy, normal individual, your blood sugar level is not going to drop to a non-life-sustaining level just because you haven't eaten. You may get hungry and you may have some drop in your blood sugar, but you're not going to go into a coma because you don't eat. People starve to death all the time, and their blood sugar never drops to a level where they're unconscious. That's just a way to think about that. Medical or traumatic head injury. This would relate to a stroke that's caused by a clot or some type of intracranial hemorrhage. All right, so identifying the exact cause of a altered mental status can be very difficult. This individual is assessing their patient. The reason it can be very difficult to determine is because they can't talk to you. Somebody that's alert and able to tell you what's going on is a much better historian than somebody that's completely unconscious. All right, some signs and symptoms of altered mental status include confusion, seizures, inappropriate behavior, lack of awareness of surroundings, combativeness, syncope, which is a collapse or faint, unresponsiveness. All right, so when you're assessing the patient, you want to focus on observation. Obtain a complete medical history if possible. Get a baseline mental status from other people on the scene if possible. Use the AVPU scale. This is going to determine if they're alert, if they respond to verbal stimuli, if they respond to painful stimuli, or if they're completely unresponsive. So how would you assess a patient that is nearly unconscious and unable to communicate? I mean, you have to do a pretty objective assessment of them. You have to go off of what you find and what you're able to measure with your medical devices. You may not be able to get any information whatsoever from them. All right, how would you obtain a medical history? Best way to obtain a medical history is to look around for medications, ask any family members or bystanders that may be around, or look for medical ID jewelry. All right, so the general assessment of altered mental status, you're going to take BSI precautions and perform a primary assessment. Monitor the patient's airway and breathing. Administer oxygen as per local protocols. Monitor vital signs. All right, general treatment of an altered mental status is going to be to provide emotional support, position the patient properly for comfort and protection of the airway. Do not administer anything by mouth. Continue to monitor the patient while awaiting EMS arrival. Alright, so seizures. Seizures are irregular electrical activity in the brain. It's characterized by a sudden change in mental status and behavior. Also generally have uncontrolled muscular movements called convulsions. There's a lot of different types of seizures. We're going to start off by discussing generalized seizures. This is going to be a regular activity that is conducted through the entire brain. The patient is going to be unresponsive and they will be having full body convulsions. Partial seizures are an irregular activity in one section of the brain. The patient remains responsive. It may progress to a generalized seizure.
Febrile seizures occur during a time in child development when the seizure threshold is low. It is postulated that the endogenous pyrogens, released by infectious organisms, and the release of cytokines by host cells increase neuronal excitability and lower seizure threshold, resulting in the onset of seizures in the febrile pediatric patient. In this example of meningeal infection, release of exogenous and endogenous pyrogens is followed by entry into the brain, resulting in seizures.
This young man is having a complex partial seizure, and his consciousness is impaired. These seizures are the most common form of epilepsy in teenagers and adults.
You want me to call him like I usually do? Kevin? 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 Can you hear me? Can you hear me?
Complex partial seizures may create a variety of automatic movements or behaviors, such as this young woman is having. She cannot control these movements, nor is she aware of them. The movements of her hands are automatic. They look like deliberate movements, but they're not. They're part of the seizure. Her awareness of her surroundings is clouded.
They may seem to be sort of vacant, staring away, and then they begin moving around, perhaps picking at clothes, wandering rather vacantly, sometimes pushing people away because they're essentially in a rather confused kind of a state.
Complex partial seizures last only a minute or two, though the teenager may feel confused for a while afterward. It's easy to mistake them for behavior problems. If restrained abruptly, the adolescent may strike out in a reflex action, which may look like fighting. The seizures most people think of when they hear the word epilepsy are generalized tonic-clonic seizures, often called grand mal. They affect the whole brain and the entire body. The tonic phase is the stiffening of the muscles. Then the jerking movements begin, the clonic activity that you see here. Tonic-clonic seizures rarely last more than a few minutes. A person having one isn't conscious and won't remember what happened. The skin may become pale. Breathing may seem shallow and labored. Sometimes a teenager may lose bladder or bowel control, or vomit as the seizure ends. These seizures may look painful or even life-threatening, but they're not. They end naturally after a minute or two.
Seizures start in the cortex at a seizure focus, and then may spread through the neighboring cortical structures, subcortical structures, and brainstem as abnormal and excessive electrical activity. The motor results of this activity may result in convulsions, which may be generalized and exhibit tonic and clonic phases. When seizures occur with no intervening interval or continuously, it is called status epilepticus. This is life-threatening, and intervention is required.
All right, guys, I hope those videos came through. They're pretty good videos. All right, let's continue with some causes of seizures. Epilepsy, this is going to be a disorder of the brain. Ingestion of drugs, alcohol, or poisons can cause seizures. Alcohol withdrawal can also cause seizures. Brain tumors, infections, specifically high fevers, most commonly in children. Diabetic problems, stroke, heat stroke, head injuries. Alright, so how does a generalized seizure present? Typically, they're going to have a sudden loss of responsiveness. They may report a bright light, bright color, sensation of a strong odor prior to losing responsiveness. This is known as an aura. Convulsions, loss of bladder control and or bowel control. They're going to experience labored breathing and probably frothing at the mouth. They're going to complain of a headache prior to or following the seizure. After the seizure, they're going to go into what's known as a postictal state. This is a phase of seizure following the convulsions. Patient's body completely relaxes. Vital signs begin to return to normal. Alright, so how might the patient appear during the postictal phase? The patient's going to they're going to look like they're just in a deep sleep. Some people describe it as they look as if they're drunk. As they progress through the postictal phase, they're going to start to wake up. They may become combative. You have to understand that during this phase, they're not aware. They have an altered mental status, and they may be dangerous, but generally they mean no ill will towards anyone, but they can cause injuries. You have to just be aware of that. Alright, so what are some clues that EMR can look for to determine that the patient had a seizure and is now in the postictal phase? Some of the biggest ones are going to be incontinence of urine. Generally, if somebody has had a seizure that has a reasonably full bladder, they are going to urinate on themselves. So that's a good thing to look at. Alright, so if you're caring for somebody that's having an active seizure, at the EMR level, the biggest thing you want to do is move objects out of the way of the patient. Place something soft under their head if possible. Don't attempt to hold them down or force anything into their mouth. Loosen any restrictive clothing they may have on. After they have stopped convulsions, you want to place them in a recovery position. Alright, in cases where the patient may be having a seizure, just protect them from the injury. If you'll look in the image, the gentleman appears to be having a seizure. Placing something soft under his head and moving anything that may be close by that he may thrash into. Alright, a stroke is known as a cerebrovascular accident, which is also abbreviated CVA, or a brain attack. This is an obstruction, which would be a clot or a rupture of a blood vessel. This disrupts blood flow to the brain. A portion of the brain does not receive adequate supply of oxygenated blood. Alright, window to restore the blood flow to the affected area is very short. Most places are looking at about 6 hours to restore blood flow. Some are pushing it out to 8 or even 12 hours these days, but 6 hours is a good rule of thumb. Thrombolytics can reduce long-term deficits. So a deficit is going to be a long-term issue associated with the stroke. Alright, some causes of cerebrovascular accidents. Blockage, which is in the image on your left-hand side. It's going to be a clot that has obstructed one of the arteries that supply the brain with oxygenated blood. To the right side over here, you've got a artery that has ruptured. This just causes increased intracranial pressure, and it causes a part of the brain to not receive oxygenated blood. Alright, stroke signs and symptoms. A lot of times people will complain of a headache or a syncope, which is just a fancy word for fainting. They may have an altered mental status. Numbness or paralysis in extremities of the face is commonly to one side of the body. That's one telltale sign that somebody's having some type of cerebrovascular accident, is the paralysis is going to be to one side of the body or face. Difficulty with speech and vision, confusion, dizziness. Alright, to evaluate this, we're going to use the Cincinnati Pre-Hospital Stroke Scale. We're going to look for facial droop, arm drift, abnormal speech. We will cover this in class in detail. A patient suffering a stroke may have facial droop on one side or the other. If you look at his face, it's obviously affected on one side. One side appears to be normal, the other side does not. Alright, so this provider is having the patient attempt to hold both arms out in front of him. It looks like he's not able to hold his right arm out. Signs of a possible stroke. Alright, so when you're caring for a patient with a stroke, you're going to take proper BSI precautions. You're going to perform a primary assessment, maintain a proper airway, administer oxygen per your local protocols, perform a secondary assessment, obtain a baseline set of vitals. Place the patient in a position of comfort, provide emotional support, perform frequent reassessments until additional help arrives. Right, this is a good image showing how to position somebody for comfort if they're already on the ground. Get them in a recumbent position. Alright, so diabetic emergencies. This relates to diabetes. Diabetes is a disease that prevents individuals from producing enough insulin or from using insulin effectively. Insulin is a hormone released by your pancreas. It allows glucose or your blood sugar to enter cells to be used as energy. Alright, so you got two different types of diabetes. You've got type 1 and type 2. Type 1 is sometimes referred to as juvenile diabetes, and type 2 is referred to as adult onset diabetes. If you want to do a little bit of research on the different types of diabetes, type 1 versus type 2, it could help you in your understanding of this topic. We're not going to dive too deep into it right here, but if you want a little bit of extra information, do a little bit of research on type 1 and type 2 diabetes.
Diabetes mellitus is a complex disorder of metabolism. It is a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. There are three major types of diabetes. Type 1 diabetes, also known as insulin-dependent diabetes mellitus, IDDM, or juvenile onset diabetes, results from the body's failure to produce insulin. An individual with type 1 diabetes needs to take daily insulin injections for the rest of their lives. It is estimated that 850,000 to 1.5 million Americans have type 1 diabetes. Non-insulin dependent diabetes mellitus, or adult onset diabetes, results from insulin resistance combined with relative insulin deficiency. Approximately 16 million Americans have type 2 diabetes. Someone with type 2 diabetes may make healthy or even high levels of insulin, but obesity makes the body resistant to its effect. Even modest lifestyle changes, such as eating a healthy diet, exercising 30 minutes a day, and maintaining proper body weight for age and body type can help prevent type 2 diabetes. Prediabetes occurs when a person's blood glucose levels are higher than normal, but not high enough for a diagnosis of type 2 diabetes. Without lifestyle changes, most people who have prediabetes will progress to type 2 diabetes within 10 years. Gestational diabetes, or pregnancy-induced diabetes, develops in a pregnant woman. In most cases, this type of diabetes goes away after the child is born. It affects about 4% of all pregnant women, or about 135,000 cases in the United States each year. The American Diabetes Association estimates that about 17 million people in the United States have diabetes, and 5.9 million Americans have diabetes and do not know it.
The brain is very sensitive to low levels of sugar. Oral glucose usually comes as a tube of gel. Apply with a tongue depressor and place between the cheek and gum or under the tongue. Swallowed glucose is easily absorbed into the digestive tract and bloodstream, which carries it to the brain. Quick administration of oral glucose when the patient is conscious and can swallow is critical to reverse a potentially life-threatening situation.
Alright, so hyperglycemia and hypoglycemia. This figure shows you kind of a relationship between them. Hyperglycemia means you got a bunch of sugar and not enough insulin. It means you've got a lot of sugar running around in the blood, but you don't have the insulin to get it into the cells. Hypoglycemia means you got just a little bit of sugar and you have an adequate amount of insulin or too much insulin. This causes too much sugar to be pushed into the cells, and that way you've got not enough insulin circulating in the blood for the brain. Alright, evaluating mental status for the hyperglycemic patient. It's generally going to be a more gradual onset than hypoglycemia. It can cause a high blood sugar. Some common causes are not taking enough insulin or eating too much sugar or too many simple carbohydrates. If left untreated, hyperglycemia can lead to a diabetic coma. Like I said, this takes a lot longer than hypoglycemia. There's just some signs and symptoms of hyperglycemia. There's going to be an extreme thirst, abdominal pain, dry, warm skin, a rapid, weak pulse, sweet or fruity odor on the breath, a dry mouth, restlessness, altered mental status including a coma. Rapid onset is a characteristic of hypoglycemia. Remember, we talked about hyperglycemia having a slow onset. Hypoglycemia has a rapid onset. Some causes of hypoglycemia or low blood sugar would be taking too much insulin, eating too little sugar or carbohydrates, overexertion, excessive emotional stress. Some signs and symptoms of hypoglycemia are altered mental status, pale, cool skin, it's often moist as well, a rapid, strong pulse, dizziness. Alright, headache, shallow breathing. A lot of times they'll be very hungry. They may have seizures. Alright, so why would low blood sugar cause an altered mental status? Alright, so the brain uses glucose in the blood directly. If there's not enough glucose circulating in the blood, then the brain can't function properly and you're going to have a change in mental status. Alright, so some emergency care for diabetic patients is going to be to take standard BSI precautions, perform a primary assessment, perform a secondary assessment, obtain a medical history, look for identifying medical bracelets, find out if the patient has taken any insulin or has eaten recently. So never give a patient anything orally if the patient has an altered mental status. Sometimes people will try to get a diabetic patient's sugar up by giving them high sugar liquids or high sugar foods. You're going to cause more problems than you're going to fix. You can cause an airway issue if you give somebody uh, food or liquids that doesn't have control of their airway. Alright, so you're going to obtain a baseline set of vitals. You're going to administer oxygen per your local protocols. If the patient is alert and oriented and it is unclear whether the condition is hypoglycemia or hyperglycemia, administer oral glucose per your local protocol or a suitable substitute. Sometimes candy or orange juice will work very effectively. If the patient is not alert, do not give them anything by mouth. How might hypoxia change the mental status? If you don't have enough oxygen in the blood, your brain's not going to be able to function. It can cause your brain to just act differently because you're hypoxic. What steps might the EMR take to immediately rule out hypoxia as a potential cause? It's something that's hard to do, even with the use of pulse oximetry. You can't completely rule it out. So if you've got somebody with altered mental status, I always consider hypoxia to be an issue. Alright, so overdoses and poisonings. A poison is considered any substance that can be harmful to the body. Overdose is when a person takes in more medication than is normal. This can be intentional or unintentional. Alright, so this is table 16.2. It's just a table of some commonly abused substances, split into uppers or downers. So some common uppers are going to be amphetamines. These can be known as benzodrine, bennies, pep pills, uppers, cartwheels. Some examples include biphetamine, BAM, cocaine, also known as coke, snow, or crack, disoxin, which is also known as our black beauties, dextromethorphan. This includes Dexize and Dextrine. Methamphetamine. This is also known as speed, meth, crystal. This also includes diet pills. Methylphenidate. This is also known as Ritalin, Preludin. Alright, some common downers are going to be amobarbital. These are known as Blue Devils, downers, barbs, amytal. Barbiturates. These are downers, dolls, barbs, rainbows. Chlorohydrate. This is also known as knockout drops, Noctec. Ethchlorovinol. This is also known as Placidil. Glutamide. This is Doridan or Goofers. Methaqualone. This is also known as Quaaludes or Ludes, Soper or Sopors. Some non-barbiturate sedatives. These are going to include various tranquilizers and sleeping pills, Valium or diazepam, Miltown, Equinol, meprobamate, Thorazine, Compazine, Librium, Chlorozepazide, Reserpine, Tranexine, or Clozapate. They also include other benzodiazepines. Alright, this is table 16.2 continued. Some common narcotics are codeine, mepridine, Demerol, morphine, Dilaudid, opium, also known as ope or poppy, heroin, H, horse, junk, smack, Stuff are also common street names. Paregoric contains opium. Methadone, known as Dolly on the street. Fentanyl. Oxycodone, known as Perk. Oxycontin, or just plain Oxy. Alright, some common hallucinogens and mind-altering drugs. Hallucinogenics. Psych. Sorry. Psilocybin. This is going to be magic mushrooms. DMT. STP, also known as serenity, tranquility, and peace. LSD, acid or sunshine are some common street names. Non-hallucinogenics, these are going to include mescaline or peyote. Marijuana, street names are grass, pot, weed, or dope. You got morning glory seeds, hash, PCP, also known as angel dust, hog, or peace pills, THC. Alright, some volatile chemicals are going to be amyl nitrates. These are known as snappers and poppers on the street. Glue. Butyl nitrate. This is going to be a locker room or a rush. Hairspray. Cleaning fluid. This can be carbon tetrachloride. Nail polish remover. Furniture polish. Paint thinner. Gasoline. Alright, so some routes of exposure are going to be ingestion, inhalation, absorption, injection. Alright, there are over 60 regional poison control centers in the United States. Note and report any containers at the scene. Check if the patient has vomited and describe the vomit. Check for substances on clothes or if the patient is wearing clothing that indicates the nature of work. Alright, this is the number for poison control. Might be a good idea to actually jot that down just in case you ever need it.
A poison is any substance that can harm the body, sometimes seriously enough to create a medical emergency. Once on or in the body, a poison may act as a corrosive or irritant, destroying skin and other body tissues. A poisonous gas can act as a suffocating agent. Systemic poisons harm the entire body or specific organ systems. Commonly, poisons act on the central nervous system to depress or overstimulate the brain. Activated charcoal is used in cases of ingested poisons and works through adsorption, the process of one substance becoming attached to the surface of another. Ordinary charcoal adsorbs some substances, but activated charcoal is different because it has been manufactured to have many cracks and crevices. By ingesting activated charcoal, the poisons bind to the increased surface area and are eliminated by the body.
Alright, some ingested poisons. They commonly cause the following signs and symptoms: burns or stains around the mouth, unusual breath odors, body odors, or odors on the clothing at the scene, abnormal breathing, abnormal pulse rate and rhythm, sweating, dilated or constricted pupils, excessive saliva or foaming at the mouth, burning in the mouth, throat, or painful swallowing, abdominal pain, upset stomach, nausea, vomiting, or diarrhea. They can cause seizures, altered mental status, including unresponsiveness. So when you're caring for somebody that's ingested a poison, you're always going to take your BSI precautions, ensure the scene is safe as well, perform a primary assessment, ensure the open airway and adequate breathing, administer oxygen or assist ventilations as necessary. After you've covered your ABCs, you're going to perform a secondary assessment, obtain as much information as possible about the specific subject, call Poison Control Center or medical direction for further instructions. Do not treat unless directed by a physician or the Poison Control Center. You can possibly use activated charcoal. Adults are going to get 20 to 25 grams. Children are going to be 12.5 to 25 grams. In case of vomiting, position the patient on one side or in a semi-sitting position with head turned to the side to avoid aspiration. If possible, save vomit for later analysis by hospital staff. This is a kid playing with some household chemicals that would be considered poisons. Just know that they can come in colorful containers and they're often very appealing to children. Alright, so inhaled poisons. These are going to be introduced to the body in the form of gases, fumes, vapors, or dust. Common causes are going to be automobile exhaust systems, stoves, charcoal grills, industrial solvents, spray cans, shortness of breath, coughing, pulse rate fast or slow, eyes being irritated are some common signs. You may also see inhaled poisons coming from smoke from a fire. The smoke is going to contain hot air and poisonous substances. It can cause burns to the skin, irritation of the eyes, burns to the airway, which can cause breathing problems. Worst case scenario causes cardiac arrest. Carbon monoxide is a common poison inhaled from smoke from fire. It takes the place of the oxygen in the bloodstream. What they mean by this is carbon monoxide will bind to your hemoglobin, which is what actually transports your oxygen to your body tissues. Once it binds to the hemoglobin, it will not turn loose. This causes there to be no oxygen transport to the tissues or a reduced oxygen transport to the tissue. The hemoglobin is going to bind about 6 times stronger to the hemoglobin than the oxygen molecule will. So there's not even a competition for the oxygen to replace it. Alright, signs and symptoms of carbon monoxide poisoning include headache, dizziness, confusion, seizures. If it's a severe case, a coma. Alright, so emergency care for inhaled poisons are going to be to move the patient to a safe area, perform a primary assessment, administer oxygen and assist with breathing as necessary. If the patient is unresponsive, let them assume a position of comfort. If the patient is responsive, let them assume a position of comfort. If they're unresponsive, obviously they can't assume a position of comfort for themselves. Obtain baseline vital signs. Monitor the airway and breathing status closely. Alright, so absorbed poisons are going to come through the skin, through a transdermal route generally. You may see some skin reactions, mild irritations, or up to severe burns. You may see hives, itching, eye irritation. Patient may present with a headache or increased skin temperature. Emergency care for absorbed poisons are going to be to remove the patient from the source of the poison. Brush any powdered chemicals off the skin with a gloved hand. Flush the exposed area with water. Carefully remove all contaminated clothing. Contact the Poison Control Center or medical direction and activate emergency medical services. Alright, some common injected poisons are going to be from insect stings, spider bites, stings from marine's life, snake bites, hypodermic needles, drug overdose or contamination. Some signs and symptoms of injected poison are going to be noticeable stings or bites to the skin, pain at or around the wound site, itching, weakness, dizziness, or collapse. Difficulty breathing, abnormal pulse rate, headache, nausea, anaphylactic or allergy shock. It's mostly known as anaphylactic shock. Emergency care for bites and stings are going to include scrape away the bee and wasp stingers and the venom sacs. Best way to do it is to use a plastic credit card. Don't pull the stingers out with your hands. Place ice bag or cold pack over the bitten or stung area. Flush the area with water when you're dealing with snake bites. Apply a pressure dressing. Monitor circulation, sensation, and motor function. transport them immediately. Alright, so emergency care for jellyfish stings. You're going to neutralize needles in the skin. We're going to stick with using vinegar and baking soda and water. There's some alternative methods that I'm not going to recommend here. Flush with hot water or use hot packs for pain relief. Right, alcohol abuse. This can lead to illness, poisoning of the body, abnormal behavior. It can also lead to death. Diabetes, head injuries, high fevers, or other medical problems can make a patient appear to be drunk. That's especially true with diabetes and epilepsy. Don't assume somebody is just drunk. They may have some type of underlying medical condition. Intoxication may mask injury or additional medical problems. What they're saying with this is if somebody is severely drunk, you may miss something else because they're not able to function appropriately. Alright, why is it important to know the medical conditions that cause a patient to appear intoxicated? Because you may be looking at signs and symptoms of something completely different. You need to be able to evaluate that patient and make sure they're not experiencing symptoms of some other disease process. Alright, so signs and symptoms of alcohol intoxication. Odor of alcohol on breath or clothing. Keep in mind this can also occur when somebody has a high blood glucose level. Swaying, being unsteady or uncoordinated movements. They can have slurred speech. They'll have inability to carry on a conversation. Just a generalized flushed appearance. Nausea, vomiting, or the feeling of the need to vomit. Alright, so when you're dealing with alcohol abuse, sometimes you'll see things called delirium tremors or DTs. They generally present with high blood pressure, a rapid heart rate, confusion and restlessness, abnormal behavior, hallucinations, which can be pretty severe, tremors. These are going to be obvious shaking of the hands. Convulsions include seizure activity. Emergency care for alcohol abuse is going to be to take standard BSI precautions, perform a primary assessment, perform a thorough secondary assessment to detect any signs of injury and illness, monitor vital signs, staying alert for the patient's respiratory problems, help the patient when he is vomiting so the vomit will not be aspirated, protect the patient from further injury. Alright, drug abuse. This is going to include uppers, downers, narcotics, hallucinogens, or volatile chemicals. Alright, so uppers are stimulants that affect the nervous system to excite the user. Downers are depressants meant to affect the central nervous system to relax the user. Narcotics affect the nervous system and change many of the normal activities of the body. Hallucinogens or mind-altering drugs act on the nervous system to produce an intense state of excitement or distortion of the user's surroundings. Volatile chemicals give an initial rush but then depress the central nervous system. Alright, so what scene safety considerations might the EMR consider upon learning a suspected patient is under the influence of hallucinogens? Alright, so you just got to be aware they can sometimes be dangerous and they can cause harm to you and your partner as well as themselves and other bystanders. Alright, drug abuse. Patient not be forthcoming with this information. Withdrawal from drugs varies patient to patient, also drug to drug. Signs and symptoms of use and overdose may mimic other medical conditions. Shaking, anxiety, nausea, confusion, irritability, sweating, increase the pulse and breathing rates. Alright, how can a patient's fear of legal consequences impact the accuracy of information you can gather during your assessment? So if somebody's abusing drugs, they may be afraid they're going to get in trouble if they tell you they've been using drugs. Reassure them that you're there to help. You're not there to cause them any legal trouble. A lot of times it'll make them feel more comfortable and they'll actually tell you what they've been doing. Alright, emergency care for drug abuse is going to be to take standard BSI precautions, perform a primary assessment, maintain an open airway and ensure adequate breathing, administer oxygen as per local protocols, monitor vital signs and be alert for respiratory arrest. Talk to the patient and gain his or her confidence by and maintain his or her level of responsiveness. Protect the patient from further harm. Continue to reassure the patient throughout all phases of care. All right, so some signs and symptoms of sepsis or a generalized infection include fever, chills, rapid breathing, rapid heart rate, low blood pressure, altered mental status. All right, so this is an infection that spreads to multiple organ systems and throughout the bloodstream. Most commonly originates in the lungs, abdomen, or urinary tract. Some signs and symptoms again of a generalized infection, sepsis, are going to include fever, chills, rapid breathing, rapid heart rate, low blood pressure, altered mental status. High risk patients for sepsis include transplant patients, infants and the elderly, radiation or chemotherapy, burn victims, individuals with diabetes, individuals with AIDS. Emergency care is going to be to take appropriate BSI precautions, perform a primary assessment, perform a secondary assessment, obtain baseline vital signs, administer oxygen as per local protocols, perform reassessment as necessary. Reactions to an allergen. These are going to be mild reactions, swelling of the skin or itching. Somebody that has a more severe reaction, it's called anaphylaxis. This is going to cause life-threatening shock. The airway can constrict and cause obstructions. The blood pressure is also going to drop because of systemic vasodilation. Alright, so some signs and symptoms of allergic reactions and or anaphylaxis are going to be burning, itching, or breaking out of the skin in hives. Difficult breathing and rapid breathing. Altered mental status. Pulse can be rapid and weak. Cyanosis of the lips and the nail beds due to poor perfusion. Swelling of the tongue and the throat, and a general feeling of restlessness. As a treatment for allergic reactions and anaphylaxis, you're going to take appropriate BSI precautions, perform a primary assessment, ensure clear airway and adequate breathing, administer oxygen as per local protocols. If unresponsive, look for any medication jewelry that may be present. Assist the patient with his or her prescribed epinephrine auto-injector as per local protocols. Monitor vital signs and ABCs until the EMS personnel arrive. Renal failure. It's going to be kidney failure. Kidneys fail to function properly, no longer filtering waste products from the blood. High-risk patients include individuals over the age of 60, individuals with a history of diabetes, individuals with a history of high blood pressure, a family history of renal failure, a family history of heart disease. Signs and symptoms of renal failure include weakness, altered mental status, generalized swelling, increased heart rate, increased blood pressure, a decrease in urination. Hemodialysis, this is going to be a mechanical filtering of the blood to remove waste and excess fluid. A patient with renal failure must receive dialysis at frequent intervals. This is done through a surgically implanted shunt. Alright, so one thing to think about when you're dealing with somebody who receives dialysis, you want to avoid assessing the blood pressure in the arm with a surgically implanted access point. Just use the other arm. Alright, so this is figure 16:10. It's just showing a shunt. You'll see it goes and it actually connects the radial artery and the cephalic vein. This is just a picture of a similar shunt that's under the skin. It's going to be a little bit higher up. Alright, so here's a scenario. You respond to a home to find an elderly female with fingernail polish on her fingers and around her lips. Her daughter reports her mother suffers from Alzheimer's disease and ingested the nail polish. The patient is pleasant and cooperative. How will you proceed? You need to look at the bottle, see how much of the nail polish has actually been ingested, and you would proceed to call the Poison Control Center. All right, behavioral emergencies. All right, behavior. This is the manner in which a person acts or performs. Behavioral emergency includes situations where patient exhibits abnormal behavior that is unacceptable or intolerable to the patient, family, or community. All right, the assessment and emergency care is going to include approaching with caution. Do not approach the patient if it is not safe. Observe for signs of agitation and or violence. Identify yourself and let the patient know you are there to help. Inform the patient of what you are doing at all times. Ask questions in a calm and reassuring voice. You don't want to be judgmental. You want to allow the patient to tell you what happened. Show you are listening by rephrasing or repeating part of what was said. Be aware of your posture and your body language. Right, what specific questions might you ask? You assess. Encourage the emotionally distraught patient to tell you what's troubling her. She just looks very upset. You can tell that this individual is trying to figure out what's going on. Alright, so you always want to assess the patient's mental status. Always consider the need for law enforcement. Answer the questions honestly when they ask them to you. Don't make quick moves. Alright, treat these individuals the way you would want to be treated if you were in the same situation. Alright, so don't threaten them. Don't challenge them. Don't argue. Do not play along with their hallucinations or auditory disturbances. Involve family if it's appropriate. Always leave yourself a way out. Don't let them get in between you and the exit. Right, law enforcement officers may be needed to approach and control a patient experiencing a behavioral emergency. These law enforcement officers have taken a defensive position. They appear to be in a safe situation and they have control of it. Don't hesitate to involve law enforcement. Alright, assess the potential for violence. This is going to include your scene size up, obtaining history. Note the patient's posture. Note if their verbal activity as well as their physical activity. Why should restraints be used only as a last resort, guys? You don't want to restrain anybody if you don't have to. This just opens you up for litigation as well as potential injury to yourself and the patient. Always try to get them to be calm and work with you. Alright, sometimes you have to restrain a patient to protect them, yourself, and others. Always let law enforcement take the lead on this. Alright, this is an image of somebody being restrained to a stretcher. Only use it as a last resort, but sometimes it is necessary. Alright, here's a scenario. You respond to a home where a woman reports that her brother has threatened suicide. He is clearly agitated and aggressively refuses contact with you and your partner. How should you proceed? In this situation, you want to back away, get law enforcement involved, and you guys are going to have to determine what this patient's level of responsiveness is, if they're able to make decisions for themselves or not. And you're going to have to proceed as the scenario dictates. Alright, we're going to go over a summary of this chapter. Conditions that cause a patient to experience their altered mental status include seizures, strokes, diabetic emergencies, poisonings, breathing problems, cardiac events. They can present with a range of signs and symptoms to include confusion and dizziness to seizures and syncope. Just keep in mind syncope is also known as fainting. Assessment and care depending on observing the patient's environment and asking questions. Seizure signs and symptoms include sudden unresponsiveness, convulsions, headaches, unusual breathing patterns. Biggest thing you want to do is clear the area around the seizing patient. Stroke signs and symptoms include syncope, confusion, partial or full paralysis, headache, difficulty speaking and or swallowing, altered mental status. You want to closely monitor for airway compromise, breathing difficulty, or cardiac arrest. Diabetic emergencies generally present with difficult or unusual breathing, abdominal pain, seizures, dry mouth. May also present with extreme thirst, a fruity breath odor. This is going to generally be in line with elevated glucose levels. They may have an altered mental status. They may be unresponsive. Hyperglycemia. This is considered high blood sugar. May complain of abdominal pain, and they generally are going to have extreme thirst. Hypoglycemia or low blood sugar. May complain of being extremely hungry. They may resist eating. They're going to have a strong, rapid pulse, shallow breathing, seizures. Generally present with pale, cool, and moist or clammy skin. When the EMR can't determine if a diabetic emergency is caused by hypo or hyperglycemia, care should be the same. Administer real sugar, provide oxygen, activate the EMS system. What they're saying by administer real sugar is do not provide any artificial sweeteners. They're not going to have any effect on the patient's blood glucose. Monitor the patient's ABCs and make the patient comfortable. Signs and symptoms of poisoning include altered mental status, vomiting or abdominal pain, sweating, abnormal pulse and or breathing, unresponsiveness, pain when breathing or swallowing, dilated or constricted pupils, weakness or dizziness. Carbon dioxide poisoning symptoms are going to be headaches, dizziness, confusion, seizures, or coma in severe cases. It's going to be a primary indicator is going to be the patient's surroundings. If they're in a house fire, that's a good indication that they may have carbon dioxide poisoning. If the patient presents with signs and symptoms and has been near any sort of combustion, suspect carbon dioxide poisoning. Big takeaways for patient care are going to be protect the airway, administer oxygen, activate the EMS system, monitor ABCs. A local, regional, or national poison control center should be contacted. Alright, sepsis. This is a condition where a once isolated infection spreads through the patient's bloodstream and becomes a systemic-wide infection. Indicators are going to include fever, chills, or confusion, unresponsiveness, rapid breathing, rapid heart rate, low blood pressure. Septic patients must be treated at the hospital. The EMR should activate the EMS system, provide them oxygen, monitor the patient's ABCs. Anaphylaxis is a life-threatening allergic reaction. You're going to have altered mental status, difficulty breathing, swelling of the throat. Support the ABCs and assist with the prescribed auto-injector if it's available. Renal failure. This is when the kidneys no longer function normally. Dialysis. This is the treatment for individuals with renal failure. It's artificial filtering of the blood and removing excess water and waste products. Behavioral emergencies. The patient is behaving in a manner that is intolerable to himself and or his family or community. EMR should ensure their own safety and safety of others near the patient. Clearly and calmly identify yourselves to the patient and ensure the EMS system. Engage with the patient with a clear, effective communication. Alright guys, we're at the point where we would generally go over review questions. We're already over an hour at this lecture. If I go much further, I might have issues getting it uploaded to YouTube. So go over the review questions in the back of your book, and that will cover the review questions. We'll also go over them in class.